I'm going to sit so that I don't go down during this presentation. So I am Kerry Devlin. I am a board-certified music therapist, and I am also a patient myself. So I have EDS and POTS. So I'm excited to be here in dual roles today. Usually as a therapist, that's a bad thing. You don't want to have a dual role with your patient. You don't want to have a relationship with them outside of the therapeutic one. But this is a cool opportunity to actually be in a dual role because I am a clinician and also have lived experience with chronic illness. So I'm going to talk to you in general about music therapy as a treatment modality, and then I'm hoping if we have time we can do a live music and relaxation experience and just talk a little bit about different kinds of music-based interventions to help support wellness and relaxation. So, just a little bit about me before we get started. I kind of have three spheres of existence in my life, or three kind of core identities. One is that I'm a clinician, so I mostly work with young children, though I do work with people throughout the lifespan. My oldest client is 85 years old, and my youngest is 6 months old. So that's a really cool part of my job. And I work with mostly neurodivergent children, so children with different kinds of developmental diagnoses, physical disabilities, ADHD, mental health needs. But then I am also an educator, so I'm adjunct faculty at Peabody Conservatory, which is Johns Hopkins Music School. And I work on an interdisciplinary team at Johns Hopkins called the Hopkins Center for Music and Medicine. So we're doing a bunch of research projects about music, specifically with the Movement Disorders Clinic at Hopkins. And I'm also on the music therapy faculty at Shenandoah University, so I teach a clinical class there. But as you can see, I'm also a patient. I get saline infusions 3 times a week and have really nice track marks on my arms. And I have to lay down on the floor sometimes during sessions. And I've had a really interesting experience over the last few years of starting to embrace disclosing my own diagnoses and disabilities with my clients, which sort of happened at an organic level. I wasn't planning on disclosing, but kids are curious beings and they ask a lot of questions. So when I have a bruise from a blown vein from an infusion on my arm, they're like, "What's that?" So I have started to use that as an opportunity to actually connect with my clients at a deeper level, because while we do have different disabilities, there's a lot of shared experience within that. So I've been having this kind of unique experience of reframing my identity as just a disability ally to actually understanding my own experience as that of someone with a disability. So that's been really cool. So just to kind of move it along, I want to tell you briefly about what music therapy is as a profession. So music therapy is an allied health profession. We often work on treatment teams alongside doctors, OTs, PTs, speech therapists, counselors, and mental health professionals. And essentially the core practice of music therapy is using music as a therapeutic tool to facilitate non-musical change. So we often support domain areas ranging from motor development to developing positive emotional coping skills to working on speech and language goals. So we kind of cover the full spectrum, and just like a physical therapist uses different kinds of exercises targeting different muscle groups to achieve therapeutic goals, we use music as a tool. And we are a clinical practice that's based in research. We have 2 music therapy journals here in the US, and we have a number of journals worldwide, but music therapists also publish in other kinds of journals. Right now I'm working on a review that's going to be in a neurology journal. So music therapists kind of crop up everywhere. There's actually over 6,000 of us here in the US and a lot more nationwide. So in order to become a music therapist, and if you're seeking out working with a music therapist, you want to make sure that they have the credential here in the US, MTBC. That means that they have completed rigorous training that involves at least a bachelor's degree, though many of us also have master's degrees or go on to complete PhD programs. We complete over 1,200 hours of clinical internship, so that's essentially 6 months working full-time, deeply embedded in clinical practice with one particular population. So I did my internship with the Kennedy Krieger Institute in Baltimore, but there are many other kinds of clinical training opportunities nationwide. And then in order to get that credential, we complete all that training, and then we pass a national certification exam, and then we have to re-up our credentials every 5 years through continuing ed credits. So this is just a little snapshot of where music therapists work kind of here in the DMV. So I am the clinical director of a private practice based in Annapolis, but there are tons of music therapists, especially in the DC area. My friend Josh owns Capital Music Therapy Services, which is kind of in Nova in this area. Notable Progressions is in the Frederick area. Augmenting Ability is in Baltimore and north of Baltimore. But then there's also music therapists working in facilities like hospitals, like Children's National Hospital. Can you hear that feedback? It is. Yeah. Should I move? I can move my body a little bit. Is it because I'm...
Every once in a while it just starts acting up.
It's bothering me. I work with people with sensory needs, so this is like the worst possible. I'm just gonna come in front. I think maybe that may be impacting. Now I got it. Okay, sorry, that was driving me bonkers, and I wasn't sure if it was in my head or real. I'm very sorry about that. I thought I was hallucinating for a moment, but so music therapists work in hospitals like Children's National. We work in schools, both public and private. There's a large team of music therapists working with Seasons Hospice, so we kind of get around, and we often work in teams, or we might be the only music therapist on staff at a facility, or if we are working for private practice, we might contract with different facilities and go in and out of many different places over the course of a week. So why music therapy? And I think this is a really important thing to mention because many of us already attend a lot of different therapies and may not really be vibing with the idea of adding another therapy to that list. I know I complain on a daily basis about all of the stuff that I have to do, all of the doctor's appointments I have to go to, all of my PT appointments, but I do think there is value, and obviously I am biased because this is my job, but I've also worked with music therapists myself for my own mental health care and have found it to be a really meaningful experience. And I think a big part of that is because music in itself is inherently motivating. When we hear music that we like, and this is documented in clinical research, when we hear music that we like, dopamine, which is like our feel-good, I just took a big bite of a gluten-free chocolate chip cookie and it tastes real good, dopamine is released, and that same neurotransmitter is released when we hear the songs that we love. So music is a motivating treatment modality, and it's also very flexible. So there are many different genres of music, there are many styles, many different instruments. We all have different profiles we all have different music that we listen to, and we are able to harness that as music therapists and use the music that you like, the music that's meaningful to you, the sounds that are meaningful to you, and we're able to creatively use that using live music and recorded music because it's such a malleable experience. When you are making music live with a therapist, there is an infinite number of possibilities and paths that music making experience can take. And that is something that's probably my favorite part of the job, is that I might enter into a room with a client and have sort of an idea of what's going to happen, and then the music that we create together might be something totally different than I anticipated because it's so flexible and because it can shift so spontaneously in the moment. That's perfect. And music is also a great medium for self-expression when we are feeling certain moods, we might turn to certain songs or styles of music. And when we do that in the moment during a session, it can provide a really meaningful avenue for expressing emotions. Big emotions, small emotions, it can all come out non-verbally and verbally through music making. But when we're talking about music therapy and chronic illness in particular, there's kind of three core areas that music therapy can really support. So the first and one that is fairly well documented in research is that the experience of live music therapy can actually reduce a patient's pain perception. And there's some new research about this. A friend of mine was just published in the Journal of Acute Care, who did quite a large study at Inova-Loudon Hospital Systems about this, and I'll talk about that on the next slide. But something that's great about music is it's not a medication. So we all probably would love to take less medications. That is something that's really meaningful to me. And the thought of having an experience that does not require me to take an additional pill that may have adverse side effects is something that I'm always interested in. So the experience of listening to live music, especially music that's crafted in the moment by a music therapist that's working with your vital signs, with those physiological signs like heart rate, oxygenation, blood pressure. Music can be used to actually shift those readings to decrease your heart rate. And kind of dovetailing, it's brain fog. Sorry. I'm going to start using that, I think. Music can reduce your heart rate, and it can also help you to relax. It can promote relaxation responses, can help release muscle tension, and can help be a really motivating way to learn, music-based relaxation strategies. I work with an adult who's dealing with a really life-changing diagnosis, and she came to me the first day and said, all I want is just to relax. I want to be able to sit down in my house for 5 minutes and not be thinking about my illness. So she and I have worked together to create customized relaxation tracks where we select music together. We've written relaxation scripts together about her favorite places. We've practiced them together in our sessions, and now she uses them independently at home. And in that way, music therapy for her was also a vehicle for providing emotional support. It's a safe space. We are trained, we take many verbal skills classes. I have a master's degree, so I've taken a number of counseling classes. I'm not a counselor, but often in the context of music-based therapeutic encounters, really strong emotions can come up. And when you're working with someone who's trained to help support you through that and help you move through that moment to the next, it can be a really powerful way to process your life experiences and to process what's happening for you right in the here and now. So here are just a couple of studies that are recent from from this year and the year prior, that are most of these studies are for hospitalized patients, either patients in the ICU, patients recovering from surgery, or patients receiving chemo infusions, but there are some transfers that can be made. So something that I think is really cool is that music therapy studies where patient-preferred live music was used. So that's a music therapist coming into the room and saying, what songs do you like? Either giving a patient a list of songs or saying, just tell me an artist that you like and let's play it together. The patients who experienced that intervention had a reduced pain scale rating from baseline before the intervention and immediately following the intervention. So in a 30-minute session, they had an average pain scale rating decrease of 1 point, simply from listening to and engaging in music that they love that was led by a board-certified music therapist. The same style of intervention decreased really important physiological markers for patients in the ICU. This Golino et al., that's the study that's just been published out of Inova-Loudon. And that was for patients in the ICU. They self-reported less pain and anxiety after a 30-minute session, and their vital signs improved. They had a decreased respiratory rate, decreased heart rate, and some of these patients were also on a ventilator. So very, very serious kinds of needs were actually supported through music therapy intervention. So, if you go to a music therapist, what might you experience? So these are 4 core interventions. The first, music and relaxation, is something that I find very helpful for myself in my own life, and I find that patients, when they're actively involved in the experience of working with me to create customized relaxation tracks using the music they love, it can be a really empowering experience to not just be the recipient of care, but to be an active participant in your own therapeutic process. So that can also be achieved through interventions like lyric analysis, where I might play a song live with a patient, or we might listen to a song together and talk about it. Find meaning in the lyrics, talk about how those lyrics might be connected to experiences in our lives, and then work through that. I work with one patient right now who is nearing needing to receive hospice care, and we are working on legacy projects. So she is working on writing a song right now that she's dedicating to all of the people in her life who are meaningful to her. So the process of our relationship started by listening to songs, and then one day she said, I want to write a song. So I said, cool, let's do it. So we are working together to create the words, we're crafting the song together. So it's a completely shared experience. And something else that is often really meaningful in a music therapy session is extemporaneous music making. So you don't need to have any music experience. Music therapists are really good at helping you find an instrument that is accessible for you to play, like drums. Drums are a great instrument to use if you are angry, if you're frustrated, if you have something you need to get out in a safe way. Drums are a great vehicle for that. So we may improvise music in the moment and work with you to process through an emotional experience. And sometimes we'll just be making music together, and then something will happen. Either it will conjure up a memory of an experience, the patient that I'm working with will do something amazing, or we'll have just a moment of realization, and that will be connected in some way to the music making. So we're going to talk quickly about kind of 4 different strategies that you can use, because I think the thought of making music, if you're not a musician, can be a really intimidating experience. So I wanted to make a point of today talking about recorded music in particular, because I'm sure we all have iPads, smartphones with a music app on it. I know Spotify is everything to me. I have tons of Spotify playlists. And so I wanted to share strategies that you could actually take with you today, but then also share some resources to connect you with music therapists if that's something you're interested in. So the first, and it sounds sort of self-explanatory, but there is something really meaningful about taking the time for yourself to actually sit down and do this, is to create customized playlists that match different feeling states. So if you are having a day where you need a really good cry, it's really helpful if you've already made yourself this is my crying playlist, or this is my calm playlist, or I'm feeling really energized, I need to do my PT exercises, I need something that's going to lift me up. So it's really helpful if you take 30 minutes or an hour one weekend and put together a couple of playlists so they're at your disposal whenever you need them. And music therapists also use something called the ISO principle, which is kind of using different elements of music to match a feeling state or to match a particular tempo. So if I was working with a patient who was kind of hooked up to a heart rate monitor and a blood pressure cuff, I might look at what their pulse is, and I might match the music I'm playing to their pulse right there in the moment. And then gradually over time, I may sequence songs together that get slower and slower. Because our brains and bodies are really smart when music is in the environment. we do something called entrain with music that we hear. So when we hear a rhythmic stimulus, when we hear a song with a really good like pulsating beat, within just a couple of beats, our brains organically and naturally synchronize to that pulse. So you can actually harness that yourself, and we do it pretty intuitively. Like if you're at the gym, you're probably not listening to like ambient spa music. You're probably listening to something with a really strong beat. So that is you naturally having that intuition to select music that matches the movement that you're doing. So you can also do this for yourself. You can literally Google songs that are 120 beats a minute, and you can go through for songs that you like, and you can sequence a playlist of songs that start at a faster tempo with the goal of kind of ending up at a more natural resting heart rate, which can be like between 60 and 80 beats a minute. Of course, it might be a little different for POTS patients, but if you have your own baseline heart rate, and if you kind of take your heart rate when you're a little more active and when it's more elevated, you have created for yourself some parameters for finding music that fits within those tempos. So some of you may already use apps like this. I love the Calm app. It's amazing. It has lots of music, sleep stories, guided meditations, and it's really reasonably priced. It's like an annual membership. I think it was like $50 or $60. But there's another app that's free that's really cool called Relax Melodies. That's basically like a mixer, a mixing board of different tones, melodies, ambient sounds, so you can actually create your own relaxation tracks. Because I don't know about you, I don't love like cheesy spa music. It's really cringy to me when I go and like get a manicure and pedicure and it's that sort of very generic spa music. So for me, that music is not relaxing. So I love this Relax Melodies app because you can literally just pick and choose exactly the sounds that you like and the sounds that are impactful for you. So you can also seek out music that is specifically designed for relaxation. And these are two artists that I highly recommend. Ryan Judd is actually a music therapist himself. He's a friend of mine, but he is an amazing guitarist, and he has a lot of albums that he specifically designed considering resting heart rate and considering different elements that we look for in a piece of music that's relaxing. So his Sleep Soundly CD is ambient ocean sounds and guitar. It's very simple, it's very repetitive, and the songs are long. They're maybe 8 to 10 minutes. So if you really give yourself a 10-minute period of listening to that track, taking deep breaths and just closing your eyes and sitting with the music for a moment, it can be a really powerful experience. If you don't love guitar music, then Daniel Kobielka is another composer who, his music is a little more ethereal. It's very suspended. There's kind of no discernible melody, but for some people who, you know, if your brain gets too hooked on whatever the main melodic line is, sometimes it's nice to have something where it's like, I don't know what this is, so I'm just gonna listen to it and I don't have to focus on the music at all. So these are two CDs that are really good of his that I highly recommend, and you can find them on Spotify, Amazon, wherever. So just some tips if you're looking for music that's relaxing for you. Rule number one is go with what you like. If you don't like an element of the song that you've chosen for your own relaxation, you're not going to relax while you're listening to it. So for me, there's no spa music on my relaxation playlists. But it's really helpful to pick songs that you actually don't know. You don't want to be able to recognize the melody, because then your brain is going to start singing that song. Like if it's an instrumental version of a song that you love and you know all the words, you may not actually have a really strong relaxation response when you hear that, because your brain is going to activate kind of thinking about those song lyrics. You also want music that's very predictable, that has kind of a small melodic range, that sort of stays in the same space, because relaxation music should hold you in a state of relaxation. And if it's doing too much, if there's a really loud moment or something really unexpected happens or the pulse is not regular, it can take you out of that experience and really defeat the purpose. And you also just want to make sure you like the instrument. You want to make sure that you like the ambient sounds. Some people really don't like ocean sounds, so I would not suggest an ocean soundtrack for that person. So it's really important to craft the music that you like, and to use that music for relaxation, or to use elements of the music that you like. Okay, so I don't know if we have time. If
It's supposed to start at 2:15, so you actually have like.
I would say we probably want at least like 8 to 10 minutes to do a relaxation, so we might, I could do a super quickie. I don't know. We can try. Okay, would you like to do a short relaxation experience?
Yes.
Okay, so I'm gonna put this here. Hope it doesn't squeak. So I'm gonna try to hook it up to my speaker so I can control it a little bit better, hoping everyone will be able to hear this, since you don't have the tracks on your, and so, just making sure that's my alarm sound too, so all my medication alarms are that sound. So, since we're probably not gonna have much time to talk about anything else after this, let me just briefly say, as my speaker is connecting, that if you are interested in working with a music therapist, one, you could just find me. I'll be around this afternoon. I have brochures and things, and depending on where you live, I can connect you with someone who's in your area. Or you can look on the American Music Therapy Association. That's musictherapy.org. They have a registry of music therapists. You can actually Google it. Or you can go to cbmt.org, which is the organization that certifies us. So you can check and make sure the person that you're working with is actually a music therapist, which I highly recommend doing, so that you make sure you're getting an appropriate standard of care. So in our brief relaxation, would you like to do, we have kind of two choices. Would you like to do one that's more body focused, that's a progressive muscle relaxation, or would you like to do kind of a more open imagery experience? Any preferences? Raise your hand for muscle relaxation. That's a lot. I'm not going to count them. Okay, put them down. Raise your hand for music and imagery. Okay. Okay, we'll do the muscles, but I feel you, music and imagery people. Okay. All right, so I'm going to try to do an abridged version of this, but just know that's kind of a hard thing to do. You know, typically a good relaxation experience is 10 to 15 minutes long. So I'm going to keep this as brief as I can. We're not, typically we would do like every muscle group. So we'd move from your head just all the way down, kind of your face, your neck. But I think we're just going to do maybe 3 or 4 so that I don't take too much time from the next presenter. So I'm going to play an artist that I really, really love. His name is, if I can find it, Mauricio Galbardi. I wanted to make sure I pronounced his name right. He's just an acoustic guitar player, but his music has really nice movement to it without being like too sedative or too activating. And it's really nice. And there's no ambient sounds because I didn't want to have to play to everybody's preferences in here. So before we get started, just kind of take a moment, sit comfortably in your chair, feet flat on the ground if you can, if that's comfortable for you. And we're going to get rolling, and hopefully you can hear my speaker. So if it's comfortable for you, go ahead and close your eyes and just focus on your breath. Notice the way your body feels in your chair. encourage you to do so. If any of these movements cause you pain, remind yourself that it's okay to sit, breathe, and take this time for yourself. This time is yours. Bring your attention to your face. If you can, gently tighten the muscles in your forehead by raising your eyebrows as high as you can, tighter and tighter, and then release, letting that tension fall away. Moving down your body, focus on your shoulders. Raise your shoulders upward toward your ears, tighter and tighter, and then release. Feeling your head floating lightly on your shoulders. Take a moment to refocus on your breath. Feel it enter and leave your body smoothly and calmly, in and out. Tightly but without straining, clench your fists, tighter and tighter, then release. Move your attention down your legs to your feet, flexing them and pulling your toes upward toward the ceiling, tighter and tighter, then release. Continue to focus on your breath and check back in with your body. If you still notice tension somewhere, send your breath to that part of your body, breathing into it. Know that you are in a safe, warm place that you can return to anytime you need. You own this place. It belongs only to you. As our relaxation comes to an end, begin to bring your awareness back to the present and back to the room. Keeping your eyes closed, gently wiggle your fingers and toes, bringing new awareness back to your body. When it feels right, slowly open your eyes and continue to breathe. Okay, well, on that note, if you fell asleep, it's totally okay. I have personally fallen asleep before during an experience like this. It just means that I'm doing my job right. So just to bring this to a close, I hope that brought you something today, even if it's just a couple of minutes of focusing on your breath and your body, because I know conferences are a really stimulating experience in good ways and also overwhelming ways. So I hope that brought you something meaningful, and I hope to connect with you throughout the day. And I guess, do we have time for questions? Probably not. We could do it. Yeah, I'll stick around for the panel. Okay, so save your questions for the panel. But thank you so much.